Good afternoon, everyone. We are live today from Sakra World Hospital, Bangalore. Here we have with us our expert, Dr. Dilip Mohan, a senior consultant of neurosurgery, to discuss all your queries on pituitary tumors. Good afternoon, doctor.
Good afternoon. Good afternoon to all the viewers.
Welcome to our live program, sir. Doctor, here are a few questions from our followers on pituitary tumors. Shall we start, sir? What are pituitary tumors and how common are they?
Pituitary tumors are more commonly known as pituitary adenomas. They are abnormal growths or tumors which arise from the pituitary gland, which is a very small gland which is essential for our body. It produces all the essential hormones, and it is situated in the base of the brain, just up behind the nose. And these tumors, of late, studies have shown that every year per 1 lakh population, around 4 to 7 cases of pituitary adenomas are being diagnosed. And if you take a survey of any general population, so almost one case per 10,000 people, you will find a case of pituitary tumor.
Can pituitary tumors be hereditary, and are there any genetic factors that increase the risk of developing these tumors?
So most of the patients having pituitary tumors, there are no risk factors, or it is not a lifestyle related disease. Most of the patients do not have any hereditary predisposition to the tumors. But sometimes they can be part of a genetic syndrome where it can run in families. But in these cases, usually there will be multiple tumors arising from different and other glands also. Like, for example, multiple endocrine neoplasias.
Doctor, my next question is, what are the typical symptoms of a pituitary tumor?
So the pituitary tumor can cause problems mainly of two types. One, due to the pressure that it creates on the adjoining structures of the brain or on the vision nerves, or it can cause problems due to hormonal disturbances. Most common symptoms of pituitary tumors are headache, blurred vision, especially the peripheral vision is affected first, followed by the central vision, generalized fatigue, and hormonal imbalances.
How do pituitary tumors affect hormone levels in the body, and what are the long-term effects of hormonal imbalance caused by these tumors?
So the pituitary tumors can be of two types, the functioning pituitary tumors and the non-functioning pituitary tumors. So functioning pituitary tumors are those tumors which secrete excess levels of hormones. So the symptoms depend on the type of hormones in excess levels in the blood. Like, for example, if growth hormone secreting pituitary tumors, if the patient is a child, they will have gigantism. That is, they will have an abnormal increase in the height of the body. But if the same thing affects the adults, they can have a condition called acromegaly, where there will be coarse facial features, the nose becomes enlarged, there's thickening of the lips, there's enlargements of the hands and feet, and in long term, it can cause diabetes and hypertension. The second functioning tumor is a tumor which can secrete excess of cortisol, which is a steroid hormone. So the long-term effects of this is obesity, diabetes, hypertension, decreased immunity, and last but not the least, the hormone or the pituitary tumor secreting the hormone prolactin. Especially in women, they can cause menstrual irregularities and a failure to conceive and have children.
Okay. How are pituitary tumors diagnosed, and what tests are typically used for diagnosis?
The pituitary tumors require a very detailed evaluation. The doctors first take a very detailed history about the progression of symptoms from the patient, and also they physically examine the patient to bring out the signs of the pituitary tumors which the patient himself or herself may have missed. So once there's a suspicion that the patient is having pituitary adenoma, blood tests are done. These blood tests check for hormonal levels. So any increase in hormonal levels, like I have mentioned before, like growth hormone, prolactin, or cortisol, itself indicates that patient has a pituitary adenoma. Next, once the pituitary adenoma diagnosis is there, now we have to localize the tumor. So for this, MRI imaging of the brain is done, which shows very clearly how big the size of the tumor is, whether it is compressing the optic nerves or the adjoining parts of the brain. So this is preferred over CT scan. And next, if the patient has complaints of blurred vision or the MRI is showing a big tumor compressing the optic nerves, patient is sent for a vision testing. Like I have mentioned before, patients to begin with will have a decrease in the peripheral vision, which the patients may not have complained. So a specialized test called visual perimetry is done to find out if any patient has any decreased vision. And last, patient is also sent to an endocrinologist to check for any other hormonal problems. So we have to remember early detection and proper diagnosis will lead to a good and a beneficial treatment for the patient.
Okay, sir. What are the treatment options available for pituitary tumors and how do you determine the most suitable treatment for a patient?
So as with tumors in other parts of the body, there are multiple ways that we can treat the pituitary tumor, like surgery, medical treatment, and radiation treatment. The surgical treatment is the most commonly used treatment for pituitary tumors, and the most common surgery done is endoscopic transnasal transsphenoidal surgery, where an endoscope is introduced through the nose and then the pituitary tumor is taken out. So the advantage of this is there are no external skin incisions and patient comfort levels are very high and they recover very fast. Very small group of patients, a surgery called craniotomy is done where an opening in the skull is made and the tumor is removed. These are reserved for very small subset of patients having very large tumors or the tumors are inaccessible through the nasal route. The next treatment is the medical treatment. Medical treatment, pure medical treatment or primary medical treatment is reserved for functioning tumors, especially those tumors producing prolactin. So there are specialized group of drugs which when given to the patient, which is usually in the tablet form, shrinks the tumor and the patient is cured of his or her symptoms. For the rest of the tumors like growth hormone secreting tumors, cortisol secreting tumors, the surgery is the primary modality and medical treatment is reserved for resistant cases. And last but not the least is the radiation treatment. The type of radiation treatment given for pituitary tumors is usually gamma knife radiosurgery or stereotactic radiosurgery, wherein precision radiation beams are directed towards a tumor. This type of treatment is reserved for patients who have undergone surgery and have a small bit of tumor left behind, or when surgery is contraindicated, like in very old patients or patients who are having other problems like cardiac disease, from which they can't undergo surgery.
What are the potential risks and complications associated with pituitary tumor surgery?
So the surgery for pituitary tumors, as I mentioned before, especially the endoscopic pituitary surgery, they are very safe. Common problems after surgery are usually related to hormonal imbalances and electrolyte imbalance, which are very temporary. The other complications, which are uncommon but which are expected, can be cerebrospinal fluid leak through the nose, infection, bleeding, or decreased vision, which with proper care during surgery can be taken care of.
Okay, sir. Can pituitary tumors recur after treatment? And if so, what is the likelihood of recurrence?
So pituitary tumors are benign. So if when removed completely, they do not have a chance of recurrence. But studies have shown around 10% of the patients they may have recurrence. So if we are able to find out at the time of treatment which tumors can undergo recurrence, we can treat these tumors aggressively by giving radiation treatment after the primary surgery so that recurrence rates are low.
My last question is, are there any lifestyle changes or preventive measures that individuals with pituitary tumors should consider?
So, as I mentioned before, patients with pituitary tumors, it's not a lifestyle related disease. And with early detection and diagnosis of the pituitary tumors, they can have successful treatment through surgery, medical treatment, or radiation treatment. And they can go back to their normal lifestyle, but they have to be on close follow up with the surgeon or the endocrinologist. And many of these patients, they will need to be on hormonal supplements for a little bit prolonged duration until their pituitary gland becomes normal functioning again.
Okay. So with this, we come to end today's end live session. Thank you, doctor, for your valuable answers.
Thank you for your patient listening.
Thank you, viewers, for joining us. If you have any queries, you can leave a comment, and our experts will answer them for you. Thank you, doctor.
Thank you.